According to the Journal of Pediatrics in 2019, approximately 1.9 million children suffered from depression, 4.4 million suffered from anxiety, and 4.5 million suffered from behavioral issues. The evidence is irrefutable. There has been a rise in mental health issues among school-aged children in America for years. In order to treat this epidemic, we have to implement school-based programs. It is the only way to address the needs prevalent in every school within every student, regardless of race or socioeconomic status. In order to establish this need, I plan to examine the prevalence of mental health issues in America among students, analyze current programs' effectiveness, and establish that the need in these schools is very real. To begin, let us look at statistics. According to the CDC in 2019, ADHD, behavioral problems, anxiety, and depression were the most common diagnoses among children. Depression and anxiety specifically increased in diagnosis rate over time. The Journal of Pediatrics substantiates this when they establish that, in the terms of causes of mental health issues, that prevalence of each disorder, that being anxiety, depression, and behavioral issues, increased with age. The CDC also found that among children living below the federal poverty level, more than 1 in 5 had a mental, behavioral, or developmental disorder. The severity between these issues ranges, but that does not mean that they're not important or do not need addressed. For example, 9.7% of students were rated by parents and caregivers who had depression as being severely affected by their condition, and approximately 45% were rated as being mildly or moderately affected. In comparison, nearly 13% of children with behavioral issues were rated by their parents as being severely affected, while 48% were rated as moderately affected. There is a variance in severity and causation, but that does not mean that students who are not being as severely affected or who are not as commonly diagnosed do not need access to resources. In order to establish that these resources are necessary, let us look at the current school-based programs. In school-based mental health programs that currently exist, all ages have showed improvement when it comes to mental health. Compared to controls, socio and emotional learning participants demonstrated significantly improved social and emotional skills, attitudes, behavior, and academic performance that reflected as an 11 percentile gain in achievement. This is according to Durlak and their colleagues in 2011. The short-term outcomes of student mental health programs and their training efforts include improvements in staff, faculty, and student knowledge, skills, and attitudes, beliefs related to mental health disorders, and associated stigma. This was found by Stein in 2011 as well. There is long-term evidence establishing that school-based programs are vital in battling mental health issues. A number of evaluations have shown success in reducing student mental health issues, such as the check-in, check-out method, which showed that discipline referrals for students dropped as far as students participating in that program. This is, again, according to Stein. Beyond just discipline rates, student mental health programs within schools have demonstrated a reduction in alcohol, opiate, and drug use among their students. They also have demonstrated that prosocial behavior has increased among mentally ill students as a result of school-based mental health programs. Now, having established the effectiveness of these programs and demonstrated that the need is very great, we must now look at what is inhibiting these programs. Students have faced a lack of funding for these programs in the past. In actuality, 75% of public schools reported that their efforts to provide mental health services were limited due to a lack of funding. This is according to the National Center of Educational Statistics in 2018. We cannot let funding inhibit our students' access to mental health services when they need them. More must be done. I have established that there is a vital need for mental health services within schools. I have demonstrated that these current programs are very effective in battling student mental health problems. We need to do more. Mentally ill students, irregardless of their background, need these services in order to have the same equal opportunities as their mentally well peers. These kids deserve representation. They deserve these services. And we must act, even if it requires more funding on the state level. Thank you.